Hello and welcome to EduSeries presentations by Cycle Technologies, where we discuss topics in family planning and reproductive health with experts in the field. This episode is about the two-day method of family planning. It's for healthcare providers as well as for anyone interested in learning about or in using the method. This is Ann Mullen with Cycle Technologies. I'm happy to be joined by Jeannette Cachan from the Institute for Reproductive Health at Georgetown University to talk about the two-day method. Ms. Cachan has worked closely with developers of the method at the Institute and continues to be one of the point persons regarding the two-day method. Hello and welcome, Jeannette.
Hello, Ann. Thank you for inviting me.
Jeannette, could you please tell us a little bit about yourself so the viewers know your role at the Institute, specifically how you're involved with the two-day method?
Yes, Ann. As Director of Capacity Building at the Institute, I typically work with service providers at different levels to support training in fertility awareness methods, but also their integration into reproductive health and family planning counseling. And specifically about the two-day method involvement that you asked me about, I worked with the research team to develop job aids and client materials, as well as the curricula for training different levels of service personnel. And most recently, I participated in the development of the algorithm for the two-day method app for smartphones that is being featured in the discussion today.
All right, and so you are an expert on the two-day method, so I was very happy to have you on the discussion today. And of course, we've collaborated on putting together the app, but you have a deeper knowledge of how the method works, and I'm hoping that you can help me explain that then to people who are watching today.
Sure, Ann.
Well, first of all, let's talk about what exactly the two-day method is. In a nutshell, Jeannette, what is the two-day method?
Well, in a few words, a natural fertility awareness method that is based on observing the presence or absence of cervical secretions as the sign of a woman's fertility. In fertility awareness, I like to indicate is the knowledge of when in the cycle the woman can get pregnant. That's a very simple piece of knowledge. And with the two-day method, the way a woman knows when she's fertile is by checking her secretions daily to know if she's in a day when she can get pregnant or not.
Well, how does this method differ from existing methods that rely on fertility signs? Why did the Institute develop a new method?
Well, there were several reasons. Surveys that the Institute, as well as others, have conducted, identified an unmet need for non-hormonal methods. In addition, the existing natural methods that are based on observing fertile signs and symptoms were a bit complex for the audiences that we were working with, and also particularly for integrating them into public health services. So we identified the need to develop a simpler approach that more women could use and more providers could spend less time teaching, as well as a method that most women could use regardless of the length of their menstrual cycle.
So it sounds like it's a symptoms-based method that's easy to use based on secretion. So how effective is this method?
The two-day method is very effective. It works very well to prevent pregnancy. In a clinical trial, it was found to be 96% effective. That means that for every 100 women who use it correctly for 1 year, fewer than 4 will get pregnant. And that is with correct use. Now, with typical use, as with other methods as well, the efficacy is reduced because it considers women who use the method well as well as women that use the method incorrectly sometimes. The failure rate for typical use is about 14%. Very close to what other user-directed methods efficacy rate is.
I see. So this method relies on cervical secretions. So I thought you could take a look here at the slide we have and explain to us what we're looking for cervical secretions.
Well, this is a very good slide that where we can see how secretions are produced in the woman's body. And it is a good indicator of fertility because it's based on the woman's hormonal process, naturally occurring fertile signs in her body. If secretions are present, it is highly likely that the woman is fertile. And if she's not having secretions, then pregnancy is almost possible. So let's take a look here at what happens in the menstrual cycle. Obviously, the cycle begins with period, and there are a few days menstrual bleeding, followed by a few days when the woman does not notice any secretions. During those pre-ovulatory days, before ovulation occurs, secretions have a much lower content of water, and which makes them less detectable around the vulva, where women can notice them. As the days go by and around the days when ovulation is supposed to take place, the water content is higher and secretions are much more fluid, and they can be they can flow down the vaginal walls much more easier, and the woman can notice them at the level of her vulva. Then as days go by after ovulation, again, the secretions become less detectable because the water content is much less, and they're going to not flow as easily as during the pre-ovulatory and ovulatory days.
So looking at this pattern of secretions and how it happens through a cycle, could you please explain how does the 2-day method work when you're applying the secretions to a method?
The 2-day method works by helping a woman know on which days of her cycle she's fertile and which days she's not. On days she identifies as fertile, she can get pregnant. And the way to do that is that she asks herself, she checks secretions daily, and then in the evening she will ask herself, did I notice any secretions today? If the answer is yes, she can get fertile today. She can get pregnant today. She's fertile. And if the answer is no, she will check, did I have secretions yesterday? If the answer is yes, she can get pregnant today because she had secretions yesterday. And if she answers no, both for having secretions today and yesterday, 2 consecutive days, she is not likely to be pregnant today. And so it's a very simple method to use.
And who can use this method?
Any woman can use this method. The important thing is that the woman has healthy secretions, and that she and her partner are able to either avoid sex or use condoms on the days that she identifies as fertile. It's a method that is available and able to be used by many women, regardless of the length of her cycle.
And something that I would like to ask, and maybe other people are wondering about this method, is why do you have to pay attention to 2 days, the today observation and then what you observed yesterday or the day before?
And the reality is that when secretions happen, they do consecutively, and that is the usual pattern. And in the modeling that was done when the method was developed, the researchers realized that the last day a woman notices secretions may not be the last day she's fertile, because she may still be having scant secretions that she's not noticing and may still be there. So to provide added security, the second day was added.
Mm-hmm. Well, that's good information to know. It's good to know why you're looking at both days. So let's talk about this in a practical sense. Let's go back to the secretions again. Here we see again a representation of the menstrual cycle showing in particular the pattern of secretions. So Jeannette, how can a woman look at this timeline and the menstrual cycle and think about how it applies to herself?
Yeah, this is a good visual because the woman can use it as a guide and start to recognize her own pattern. What we see here very similarly to the two slides before, we can see the cycle obviously beginning with menstruation, then followed by a few days where the woman does not notice secretions, and secretions begin to appear in very small amounts. During this time, it's important for the woman to be very attentive to make sure that she's observing and detecting any secretions because they're very scant. Regardless of the quantity or the quality, any secretions indicate for this method that the woman is fertile. As days go by, you can see that secretions start to increase, and it coincides with what we were talking about what happens in terms of the water content of secretions that are easily detectable because they flow more easily. So as you see, as days go by, the secretions become more abundant. They're much more easier to detect, and they gradually disappear as days go by, and then there will be days with no secretions until the period starts again and a new cycle begins. So every woman is different in terms of how many days she sees for secretion for her period, as well as for secretions. But in general, the pattern is like this for most women.
So, and when applying the algorithm and she's looking for secretions, how do you recommend a woman look for them? I mean, how should she find them?
Okay, yeah, there are a number of ways which women can do that. Some women, and this is the most common practice, is for women to wipe themselves and before urinating and look at the toilet paper to determine whether there are secretions or not. And women are able to actually differentiate secretions from wetness, from urine, or even differentiate them from semen if they've had intercourse the night before or that morning. Another way is to check in the underwear, and yet another way is for women to check their vulva with their clean fingers. And many women actually like to do that when they're starting to learn the method because they want to be absolutely sure that they are secretions or not. Another way is to feel a sensation of wetness around the vulva. And this is something that women learn to do very quickly and rely on if they don't have a chance to go to the bathroom to check. And we recommend that women who are starting to use the method rely on more than just sensation. They should be actually checking as well until they are able to really detect the early secretions during her cycle.
So it sounds like she has a lot of options. Another thing I was wondering about is when a woman is checking today and yesterday and so on, how many days in a row can she expect to see secretions? How many days can she consider herself fertile approximately?
Every woman is different in the same way she has different cycle lengths and different number of days when she's bleeding. She will have different number of days with secretions. On average, it's between 5 to 14 days. And for women with longer cycles, it may be a little bit more, a few more days. It's important for women to know that if they have less than 5 days of days with secretions consecutively, it may be a sign that they are not really checking well, and they need to probably go back and learn how to use the method. how to observe their secretions. And for women that observe more than 14 consecutive days with secretions, there might be the possibility that that's an indication that she has an infection, so she should be checked. However, it's possible that after being checked, that is her pattern, that she has many more days with secretions, but it's important to determine that there's not a problem.
So it sounds like there's a wide variety, but a woman learns what is her own pattern.
On average, between 5 and 14 days.
So going on to using the method on an ongoing basis, I know that one of the initial challenges when the two-day method first came out was just keeping track in a consistent way. So now, Jeannette, we have the iPhone app, which has really been a good tool to apply this algorithm of the two-day method. So I have here for the viewers some screenshots to get familiar with the app. On the far left, you can see just how it looks in general, the two-day method. When you go to the App Store, you'll see this symbol. Currently, it's only available for iPhone. Now, after you've downloaded the app, you'll be asked, or this will be one of the things that you're asked, there will come a reminder in the evening. And Jeannette, maybe you can mention why it's defaulted to ask someone in the evening to enter their observations.
It's an important question, Anne, because the idea is that the woman checks her secretions in the afternoon and evening. And so if she needs to give herself some time to be able to check what happens throughout that time. So it is in the evening that the app will prompt her whether she noticed any secretions during that time.
So we have the screen here where a woman, after she's made her observation, she enters what she's seen. So yes or no, or perhaps she's had her period, she would enter that. And if she doesn't know, she enters that as well. And then it goes to step 2. The app applies the algorithm that we explained about today and yesterday. And it shows whether or not pregnancy is possible. It shows what observations were seen. And then in the right-hand corner, you can see that we have a feature for notes. So a woman can take a note. When she clicks on there, this rectangle flips over, and she can write or read a note that she's already written. Just a note on if she enters don't know, the app will default to a conservative status and tell her that pregnancy is likely, just to make sure that there's lower risk if she forgets or doesn't look at her secretions that day. There's a calendar view as well, so a woman can keep track of how many days she's observed. So you click on calendar, it's all imposed on the month there. And finally, there is a cycle history. So the app does keep track of everything a woman's entered, keeps track of whether she's had intercourse, that little heart symbol, and whether she's taken a note for that. So it's an easy way to use the two-day method and can be easily entered into a daily routine, especially for women who rely on their phone a lot, which many people do nowadays. I don't know if there's anything about the app that you wanted to add further, Jeannette? Or
It's really a step forward in terms of recording, and it makes it much easier for, as you said, for women to rely on their phone, to be prompted rather than to be keeping track on a paper log, which is the way it has been done until recently.
Oh, very good. Thank you very much. Now, that brings us to the end of our presentation of two-day method and the app, how to use it. If anyone has questions, you can contact us, or you can look on the websites. There is the main site for anyone. It's called the TwoDayMethod.com. And there you'll find information on the method, also information on the research behind the method, and a page about the iPhone app, and you can connect to Apple iTunes from there or the App Store from there, as well as a page with frequently asked questions. They're very involved. Another resource that we have listed here secondly is IRH.org. That stands for Institute for Reproductive Health. And there's deeper information about the efficacy, trials, and so on. Healthcare providers may in particular be interested in the IRH side. They also have further resources also for counseling and teaching about the method. And as I mentioned, if you'd like to contact us, you can do so directly. Here's our phone number. Also our email address, info@cyclebeads.com. You can keep track of our events through Facebook and also through Twitter. We'll also host live Q&A events on this topic and other topics, which we'll announce on our social media. If you'd like to be added to our announcements list to get an email about our upcoming events, please drop a note to info@cycletechnologies.com. And you can find other EduSeries videos on our Cycle Technologies YouTube channel. Thank you for viewing. This is Ann Mullen with expert on TwoDay Method, Jeannette Cachan, saying goodbye. Goodbye. Thank you, Ann. Thank you, Jeannette.